Most people who wake up with swollen ankles do the same thing. They look down, press a finger against the skin, watch the small dent stay there for a few seconds, and think, I must have eaten too much salt yesterday. Or, I was on my feet too long. Or, it will go away by lunchtime. And sometimes it does go away. And that is exactly why this warning goes ignored for months, for years, until the body has no choice but to escalate the signal into something impossible to dismiss. What I am about to show you in this video is not meant to frighten you. It is meant to give you information that most people over 60 never receive, not because their doctors are hiding it, but because a routine appointment lasts 12 minutes, and swollen ankles rarely make the top of the list. By the end of this video, you will know what your body is actually communicating when you wake up with swollen feet and ankles, which signals separate a harmless cause from a dangerous one, and what 3 specific questions you need to ask your doctor at your next visit. Stay with me until the end, because the third cause I will cover is the one almost nobody talks about, and it may be the most important one of all. Before we go any further, I want you to understand something important about how the body manages fluid. Every hour of every day, your cardiovascular system is moving blood through a network of vessels so extensive that if you laid them end to end, they would circle the earth more than twice. As blood moves through the smallest of these vessels, the capillaries, a small amount of fluid naturally leaks out into the surrounding tissue. That is normal. That is expected. The lymphatic system and the veins are designed to collect that fluid and return it to circulation. When you wake up with ankles that look like they belong to a different person, it means one of 3 things has gone wrong in that process. Either the veins are not returning fluid efficiently enough, or the lymphatic system is overwhelmed, or the organs responsible for regulating fluid balance, the heart, the kidneys, the liver, are sending a distress signal that the body has translated into visible swelling. Here is what makes morning swelling particularly significant. Gravity works against fluid accumulation when you are upright. During the day, swelling that builds up tends to shift and spread. But when you lie flat overnight, fluid has the chance to pool. If you wake up and the ankles are already swollen before you have even taken a single step, that tells a doctor something very specific. The problem is not positional. The problem is systemic. The first thing your body may be warning you about is your heart. When the heart begins to lose pumping efficiency, a condition doctors call heart failure, though that term is far more alarming than the reality for most patients, it can no longer move blood forward through the circulation as powerfully as it should. Blood begins to back up, and when blood backs up in the venous system, fluid is pushed out of the vessels and into the tissue of the lower legs and ankles. This type of swelling has a name: pitting edema. If you press your thumb firmly against the inner side of your ankle for 5 full seconds and release, and the indentation remains for more than 2 seconds, that is pitting edema. It is not a diagnosis, but it is a signal worth taking seriously. There are 3 additional signs that, when they appear alongside ankle swelling, make cardiac involvement far more likely. The first is shortness of breath when lying flat, which causes many people to start sleeping with extra pillows without fully understanding why. The second is fatigue that feels different from ordinary tiredness, a heaviness that does not improve with rest. The third is a subtle but persistent cough, particularly at night, caused by fluid accumulating near the lungs. If you recognize more than one of these alongside your morning swelling, please do not wait for your next scheduled appointment. Contact your doctor this week. Heart failure caught early is manageable. Heart failure ignored for months becomes something else entirely. The second warning your body may be sending involves the kidneys. Healthy kidneys filter approximately 45 gallons of blood every single day. They decide what stays, what gets excreted, and critically, how much fluid and sodium the body retains. When kidney function begins to decline, and after 60, this decline is far more common than most people realize, that regulation breaks down. The body holds on to sodium. Sodium pulls water into the tissue, and the tissue that shows it first, because of gravity and because it is furthest from the heart, is the tissue around your ankles and feet. What makes kidney-related swelling different from cardiac swelling is subtle but important. Kidney swelling often develops more gradually, appears puffier and softer rather than firm, and may be accompanied by changes in urination, going more frequently at night, producing urine that is foamy or darker than usual, or noticing that output has decreased even when fluid intake has not changed. The number that matters here is something called the GFR, the glomerular filtration rate. It is a simple blood test. Many people over 60 have never had it done, or have not had it done in years. A GFR below 60 indicates chronic kidney disease that requires monitoring. Below 45, dietary and lifestyle adjustments become critical. Below 30, a specialist needs to be involved. Ask your doctor for this number at your next visit. Write it down. Track it over time. Your kidneys are working silently every hour of your life, and they deserve that level of attention. Before we continue, I want to ask you something. Do you know someone, a parent, a sibling, a neighbor, a close friend, who has been dismissing swollen ankles for months? Someone who keeps saying it is just the heat, or just the salt, or just getting older. Share this video with them right now. Pause, send it, then come back. Because what we are about to cover in the next few minutes is the part that most doctors simply do not have time to explain during a standard appointment. And it may be the most important information in this entire video. The third cause is the one almost nobody talks about. And in my experience, it is the one that surprises people the most. The liver. Most people associate liver problems with alcohol or with jaundice, that yellowing of the skin and eyes that signals something has gone seriously wrong. But liver function can decline gradually and silently for years before those dramatic signs appear. And one of the earliest, most overlooked indicators of that decline is swelling in the ankles. Here is why. The liver produces a protein called albumin, which acts like a sponge inside the blood vessels, holding fluid where it belongs. When liver function deteriorates and albumin production drops, fluid leaks out of the vessels more readily. It settles in the legs, it settles in the abdomen, and it does so quietly, without pain, without obvious symptoms, while the rest of the body tries to compensate. There are 3 signs that, alongside ankle swelling, suggest the liver deserves a closer look. The first is a sensation of fullness or bloating in the upper right side of the abdomen, even after eating very little. The second is a general loss of appetite that cannot be explained by medication or mood. The third, and this one is less known, is a faint spider-like pattern of small red vessels appearing on the upper chest or shoulders, which doctors call spider angiomas. A liver function panel is a blood test. It is straightforward, inexpensive, and should be part of any senior health screening. If yours has not been done recently, request it. Now I want to address something that is responsible for a significant percentage of ankle swelling in people over 60, and that is medication. There is a list of commonly prescribed drugs that cause fluid retention as a side effect. And because these medications are often prescribed for conditions that are themselves more common after 60, This problem is far more widespread than most patients realize. Calcium channel blockers, a class of blood pressure medication that includes amlodipine, nifedipine, and felodipine, are among the most frequent causes. They cause the blood vessels to dilate, which is the intended effect, but that dilation also allows fluid to leak into surrounding tissue, particularly in the lower legs. Certain diabetes medications, particularly the older class known as thiazolidinones, also cause fluid retention. NSAIDs, anti-inflammatory pain relievers including ibuprofen and naproxen, cause the kidneys to retain sodium when used regularly. Steroids, whether prescribed for inflammation, arthritis, or autoimmune conditions, do the same. This does not mean you should stop any medication. It means you should have a specific conversation with your prescribing physician. You can say exactly this: "I have been waking up with ankle swelling, and I would like to know whether any of my current medications could be contributing to it. Could we review the list together?" That is a reasonable, specific, medically appropriate question. And it opens a conversation that may lead to an adjustment, a substitution, or simply a confirmation that what you are experiencing is known and being monitored. There is a fourth cause that is less dangerous than the others I have described, but far more common, and still worth understanding clearly. Chronic venous insufficiency. The veins in your legs contain tiny valves that open to allow blood to flow upward toward the heart and close to prevent it from falling back down. As we age, those valves can weaken. Blood pools in the lower legs between beats. Pressure builds in the venous walls. Fluid is pushed into the surrounding tissue. This is venous insufficiency, and it is the most common non-systemic cause of ankle swelling in adults over 60. The pattern is different from the other causes I have described. Venous swelling typically worsens throughout the day as gravity accumulates fluid, and improves overnight when the legs are elevated. So if your swelling is minimal in the morning but builds by the afternoon and evening, venous insufficiency is more likely than a cardiac or renal cause. The visible signs include aching or heaviness in the legs, visible varicose veins, and in more advanced cases, a brownish discoloration of the skin around the lower ankle, caused by iron deposits from red blood cells that have leaked through the vessel walls. The management involves compression stockings, elevation, regular walking, and in some cases, procedures to address the damaged veins directly. It will not resolve on its own, but it is absolutely manageable when addressed properly. Let me give you something practical right now. There is a simple 3-step self-assessment you can do at home that takes less than 2 minutes and gives you genuinely useful information to bring to your doctor. Step 1. Do this in the morning before you have been walking around. Sit on the edge of the bed with your feet flat on the floor. Look at both ankles and compare them. Are they symmetrical? Swelling in one leg only points toward a different set of causes, including blood clots, than bilateral swelling in both legs. Step 2. Press your thumb firmly against the inner side of your ankle, just above the ankle bone, for 5 full seconds. Release. Does the indentation disappear within 2 seconds, or does it remain? If it remains, that is pitting edema, and it needs to be mentioned to your doctor. Step 3. Think about the pattern over the past 2 to 4 weeks. Is the swelling present in the morning or only in the evening? Is it getting worse over time, staying the same, or varying randomly? Has anything changed recently? A new medication, a change in diet, a new diagnosis, a period of reduced activity? Write those answers down. Bring them to your appointment. That information gives your doctor a starting point that a brief physical examination alone cannot provide. When you see your doctor, I want you to ask 3 specific questions. Not vague questions, specific ones. The first question is this: could you check my BNP or NT-proBNP level? That is a blood marker for cardiac stress. Elevated levels indicate that the heart is under strain. It is a single blood test that can either rule out cardiac involvement or flag it for further evaluation. Many primary care physicians will order it without hesitation if you ask directly. The second question is, what is my current GFR and has it changed from my last result? You already know why this matters. Kidney function declines silently. Tracking the number over time is the only way to know whether it is stable or declining. The third question is, could any of my current medications be contributing to this swelling, and is there a clinically appropriate alternative we could consider? This is not a challenge to your doctor's judgment. It is a collaborative conversation. And doctors who know their patients are asking the right questions tend to give those patients more thorough answers. You are your own best health advocate. These 3 questions, asked calmly and directly, can change the direction of a 12-minute appointment. I want to be direct with you about something before we close. There are specific scenarios in which ankle swelling is not a signal to investigate over the next few weeks. It is a signal to act today. If you develop sudden, severe swelling in one leg only, particularly if it is accompanied by redness, warmth, or pain in the calf, that pattern is associated with deep vein thrombosis, a blood clot in the leg. This requires same-day evaluation, not tomorrow, today. If swelling is accompanied by sudden shortness of breath, chest pain or pressure, or a feeling of extreme breathlessness when lying flat that was not present before, go to the emergency room. Do not drive yourself. Call for help. If the swelling develops rapidly over 24 to 48 hours rather than gradually over weeks, and is accompanied by fever, or one leg is significantly more swollen than the other, that also requires urgent evaluation. These scenarios are not the most common reason for ankle swelling, but they exist. And knowing the difference between a warning signal that requires a scheduled appointment and one that requires immediate action may be the most important thing you take from this video today. Your body does not swell without reason. Every sign, every symptom, every change that feels small enough to dismiss, your body is using the only language it has to tell you something needs attention. The question is never whether the body is speaking. The question is whether you are listening. Waking up with swollen ankles is not a normal part of getting older. It is not something to accept as the price of aging. It is information. And now you have the context to use that information wisely. If this video helped you understand something you have been ignoring or something you have been worried about without knowing what to do, I want you to leave a comment below. Tell me, which of the 4 causes surprised you most? Your answer helps me understand what to cover next, and it helps other viewers who are going through the same thing know that they are not alone. Subscribe to this channel and turn on notifications. Every week we bring you this kind of specific, practical health information designed for adults over 60 who want to take their health seriously, without panic, without confusion, and without having to spend hours searching the internet for answers. Your body is telling you something. Now you know how to listen.